Hello and good evening and welcome to the Royal Society of Medicine and the RSM climate change episode, Mental Health in a Planetary Crisis. This is the 7th episode of the Health Emergency of Climate Change series, and this one will explore the psychological impacts of climate change on mental health and well-being, as well as providing health professionals with the tools and tips needed to respond. This is all about action. I'm Adrian James, I'm President of the Royal College of Psychiatrists, and we have a global panel of speakers. I'll introduce them in more detail before they speak. Ashley Consolo, Lisa Page, and Elizabeth Thuti. We are facing a planetary crisis whose impacts are real, rapidly developing, and difficult to imagine. These effects are felt largely in the global south, but increasingly in countries such as the UK, which is one of the world's most biodiverse poor countries, but also is now bearing the burden of unpredictable severe weather. Research from the Royal College of Psychiatrists found that more than 4/5 of the UK public think that climate and ecological emergency will affect mental health in a decade at least as much as unemployment and COVID-19. And so the Royal College has recently launched our position statement, our planet's climate and ecological emergency, and it includes pledges of actions by the Royal College as well as demands on the whole system. This is a core mental health and mental illness issue. So I'm going to introduce our first speaker. We have 3 speakers, and then there'll be an opportunity for Q&A. So please do post your questions in the Q&A box. So our first speaker is Lisa Page. Lisa is Clinical Senior Lecturer at Brighton and Sussex Medical School, an Honorary Consultant Liaison Psychiatrist and Medical Research Lead at Sussex Partnership NHS Foundation Trust. I'm really proud and pleased that she's Associate Registrar for Sustainability at the Royal College of Psychiatrists. She's got an MSc in Public Health at the London School of Hygiene and Tropical Medicine and a PhD from the Institute of Psychiatry. And Lisa's going to give us an overview of the adverse effects that climate change has on mental health. So don't forget the Q&A. Over to you, Lisa. It's going to be a great evening.
Thank you for the introduction, Adrian, and thank you very much for inviting me to speak at the Royal Society of Medicine. It's a great pleasure. So this evening, I'm going to focus on why the climate and ecological disruption that we're seeing doesn't just have implications for physical health, but also it does have far-reaching implications for mental health. And I'm going to finish towards the end by looking at how clinicians can approach this in our day-to-day work. So that hopefully will be helpful for the clinicians who are listening. But first, a quick quiz question, please. So this is for all of you, and you should be seeing a poll coming up on your screen shortly. So who said this about climate change in September 2020? The quote is, "This is a mental health crisis we are seeing here, or we are dealing with here." And that was about climate change that quote was said. So please do cast your vote. Do you think it was most likely to be, there's only one correct answer here, was it Dr. Adrian James, who you've just met? So remember, Dr. James was elected on a platform of sustainability to the presidency of the Royal College of Psychiatrists in 2020. Perhaps so it was Nadine Dorries. She is, after all, a former nurse, and she holds the mental health brief for the UK government. But maybe it was Cristina Figueres, who oversaw the signing of the Paris Agreement in 2015. Or maybe it was Bernard Looney, who is the chief executive of one of the most powerful oil and gas companies in the world, BP. So please do cast your vote. I'll give you a couple more seconds to make your decision, and then we will ask for the results to be shown. I have to say, it is the sort of thing that Adrian James might well say. There's quite a split. Yes, so I can see why people went for Adrian James. It isn't, in fact, him. Nadine Dorries, no, I'm afraid she didn't say this, but actually when I wrote this question, I thought maybe she should listen to this whole webinar series in actual fact. Cristina Figueres was present when this was said, because it was said on her brilliant Optimism and Outrage podcast series, but actually it was Bernard Looney who said that. And I think that if we have CEOs of oil and gas companies saying things like this, then we, as people who are primarily interested in health and mental health, we really need to understand this issue and see whether he was on to something there. So let's close that poll and move on with the presentation. So before we get into the detail of how the climate and ecological disruption is impacting on mental health, I'm going to start by reiterating the critical nature of the twin climate and ecological emergencies. So looking at climate change first, on the left we have a graphic which shows 9 of the so-called tipping points that have been identified by geographers and climate scientists as being of major importance. Now these are points of no return, and once these tipping points are passed or flipped, then there are likely to be non-linear or cascade effects whereby there's further excessive release of carbon into the atmosphere and then very significant environmental destabilization. Sadly, around 3 of these points are very likely to have been crossed already, and further pushing of these points and the passing of other tipping points is inevitably going to lead to major environmental change across the globe with massive impacts on human health. So we really do have a very short time in which to act. In terms of the ecology of the planet, well, we're losing habitat, soil, and species at an unprecedented rate, such that it's being termed the 6th mass extinction this period we're living through. The oceans are polluted, and this data from the World Wildlife Fund shows that that's shown on the right, shows there's been an overall reduction in about 68% of animal species across the globe since the early 1970s. So it's not a good picture. And if you want to know more about these issues, I would point you in the direction of the recently released Netflix documentary that David Attenborough and Johan Rockström presented, which is called Breaking Boundaries, which goes through these issues. So we are facing something very significant, and there are going to be major effects on human health, and these effects are already starting. Earlier in the episodes of this webinar series, you've outlined and heard, if you've been listening to those, you've heard about some of the physical health impacts of climate change. And one way of looking at the health effects generally are by direct or indirect effects. And we can do that for physical health, and we can do that for mental health as well. So if we turn to the direct effects first, these are in some ways a bit simpler to quantify. And we know that as global warming increases, we're seeing increased weather-related extreme events, and these include things like floods, storms, heat events, droughts, wildfires. And there's now ample evidence of the impact of these events on people's mental health, and this can stretch from transient mental distress right through to increased prevalence of anxiety, depression, PTSD, substance misuse disorders, and so on. So for the sake of brevity tonight, I'm just going to focus on 2 of these areas, flooding and heat for now, as these are the most relevant probably to the UK. So taking flood events first, well, the mental health effects of flooding are much more important actually than the physical effects, and about 80% of disability adjusted life years lost in floods are due to the mental health effects. And this recent systematic review and a meta-analysis just focused on the impacts of UK flood events. And you can see from this summary table that the prevalence of anxiety, depression and PTSD were all elevated sometime after flood events. So this is a long-lasting effect. The authors found that lack of a flood warning, depth of flooding and displacement were all factors that increase the risk on people's mental health. And other work in this area has shown that yeah, these effects are quite long lasting, and cohort studies in the UK have shown that. So if we move on to heat, well, it's well recognised that heat has an adverse effect on human health, including on human mortality, particularly unaccustomed heat. And we can see the figure in the left shows the extent to which average mean temperatures have increased due to human activity in our lifetimes, and particularly since the early 1990s, with the red line showing where we are now in terms of average mean temperature, and the amber line showing where we would have been were it not for human activity and release of carbon emissions. So the map, the global map, shows the excess mortality from heat that is attributable just to human-induced global warming. And what you will see is that some areas are more affected than others. So particularly South America, Southern Europe, Scandinavia are areas where there is believed to be already excess mortality that's quite marked and considerable. And overall, up to 37% of heat-related deaths since '91 are attributable to human-induced climate change, which is quite sobering. So for anyone who says this is something for the future, this type of work, which is published just this month, goes some way to refuting that. So we also know that heat and heat waves have adverse effects on mental health in particular, as well as general mortality and other forms of morbidity, and that heat particularly affects the morbidity and mortality of people with pre-existing mental illness. So the plot on the left shows how all-cause mortality in those with serious mental illnesses increases as the temperature threshold rises. And this is a much greater effect than we see in those without mental illness. And the plot on the right is an example of how hospital attendances and admissions for mental health reasons increase above a certain temperature threshold, this particular data coming from Australia. So this summary slide shows where we have evidence for the heat effects on mental health. There is an established link with suicide and increased heat. We have evidence of increased emergency departments and mental health admissions due to heat. There's also emerging evidence of increased behavioural disturbance amongst patients or residents of restricted settings, such as nursing homes or psychiatric inpatient units during heat waves. And in addition, there is a literature on the negative effects of unaccustomed heat on general population mental health, including increased psychological distress and reduced well-being at these times. So this is a useful summary slide. I'm not sure how well you'll be able to see it on screen, but it's from a recently released summary of the evidence from the Grantham Institute, and it illustrates both the direct and indirect effects on mental health in one slide, or attempts to do that. And we'll see that the more direct effects on the left-hand side of the screen, moving to more indirect effects on the right. And so let's turn now to those indirect effects. And I want to stress that these effects are already happening, and they're likely over time to be much greater and more significant than the direct effects, I think, but they are more challenging to quantify. So we know that changing weather patterns in the global south are already leading to land use change, forced migration, and even conflict. And at the end of 2019, the UNHCR estimated that nearly 80 million people were forcibly displaced from their homes. Around 51 million of those were internally displaced within their own countries. So these large-scale changes to people's ways of life and family structures result in separation, urbanization, and these all have major implications for people's mental health. And these social changes particularly impact on the elderly, women, children, and other vulnerable groups, which include those with mental health problems. And sometimes these are the people that are unable to move and end up having to stay in places which have become untenable otherwise to make a living in. And if we look closer to home in Europe and the US and other developed countries, we can observe the indirect effects of the knowledge of climate change on levels of emotional distress amongst children and young people. And we also see this, I think we're going to hear about this later, amongst people who know that their lands and their homes are being affected already by these climatic changes. And my psychiatric colleagues who work with young people tell me that this material is frequently quite preoccupying and worrying to the young people that they see in their clinical practice. So I'm left in no doubt that all health professionals must respond to the climate and ecological emergencies. And we can do this at different levels, and you can take a level that suits you and where you're at. So I would say we can act from an individual level as a citizen right through to opinion leaders, as this slide hopefully demonstrated. And I'm especially interested in encouraging health professionals to work in their own organisation. So here in the UK, that might be through your NHS trust, or it might be with your professional body. And I'm going to spend the last few minutes thinking about what sustainable and planetary friendly mental health practice might look like. And the first thing is to remember that sustainable healthcare is also good quality healthcare, and it aligns surprisingly tightly with other drivers, such as here in the UK, the NHS long-term plan. So things like we need to focus on prevention. The most sustainable thing we can do is keep patients well, and that means intervening early before people are in crisis. We want to provide high value care, and that means providing care at the right time in the right place. We should be empowering patients and staff in their own care. And along the way, we can also reduce the carbon footprint of our services by being aware of carbon hotspots and inefficient use of carbon care pathways. So for those of you based in the UK and working in the NHS, I would suggest looking at the Greener NHS programme. This outlines how the NHS is planning to become the first net zero healthcare system by 2040. Finally, I just wanted to give a shout out for the ample evidence of the link between green space and mental well-being. And this has come very much to the fore over the last year of COVID, and many people are now aware of the need to get out into nature in order to prevent or manage mental health problems that they may have. And this is also true for patients who are under the care of mental health services. So thank you for listening to me today. To recap, we've reminded ourselves of the jeopardy that we face with respect to the climate and ecological breakdown, the challenging implications for people's mental health across the globe. We've looked at indirect and direct pathways on people's mental health, and we've also briefly glimpsed some possible ways of addressing this from within healthcare services. And hopefully I've convinced you that Bernard Looney might have been onto something when he said that quite astounding thing in September of last year. Finally, I'd like to recommend these two freely available documents which explore the links between climate and ecological change and mental health in much more detail than I've managed tonight. Both have been published in the last month, the one on the left by the Royal College of Psychiatrists and the one on the right from the Grantham Institute at Imperial. So many thanks for your time. Thanks for listening to me, and I will hand back to our chair.
Well, thanks so much, Lisa. You set the scene extremely well, and already some questions coming in. So please do contribute those questions. Be as controversial and to the point as you want to be. So I'm now going to pass over to our next speaker, Ashley Consolo. Ashley is the founding dean, the School of Arctic and Subarctic Studies at Labrador Institute of Memorial University. She's a research chair and professor, researcher and environmental advocate, and Royal Society of Canada College member and founding member, Women for Nature. She's a passionate researcher and environmental advocate. She's recently been recognised nationally and internationally for her community-led research and science outreach, including being inducted as one of the inaugural members of the Royal Society of Canada's College of New Scholars, Artists and Scientists. So Ashley's going to speak about ecological grief, impacts on Indigenous people. So over to you, Ashley.
Wonderful. Thanks, Adrian, and thanks everyone for the invite to join you all the way from Canada. I'm delighted to be here, and a special thanks to Lisa for setting the stage. There's so much interesting overlap between what I'm going to speak about and what you presented, so thank you very much. So my name is Ashley, and I am currently living in Northern Labrador. So I was born and raised in Ontario and in Canada. I'm Italian and Irish, so I'm not Indigenous, but I've spent the past 12 years working with Inuit and Indigenous peoples across the north in Canada and throughout the circumpolar north. And now I'm currently living in Labrador, continuing this work and continuing to learn from people who are at the front lines. So just a little way of an introduction. This is Rigolette. This is one of the Inuit communities in the Nunatsiavut land claims. So you can see in the call out box there where Labrador is in Canada, in case you're unfamiliar. So Labrador is, if you remember back to one of the slides that Lisa shared around some of the tipping points, there was a piece around ice loss, boreal forests, and the Atlantic circulation. Labrador is actually at the intersection of all three. So we have an Arctic climate, but we're in Arctic and subarctic region, and we have boreal forests, and we also have Arctic tundra. We're right on the coast of the Atlantic, so we're deeply affected by anything that's happening there with the Labrador Sea. And Labrador is actually the fastest warming place in Canada and one of the fastest warming places anywhere in the north. So this is right at the front lines of a changing climate. And what that means is it's also right at the front lines of the mental and emotional and psychological impacts of climate change. So this community is a community of 300. And it's like most Inuit communities in Canada, there are no roads in and out, they're remote only. So it's fly in the winter and summer by boat. And Rigolette has been at the forefront of leading climate change research for well over a decade because they have been experiencing many, many impacts of climate change, which has impacted their lives and their livelihoods. So just to situate a little bit, this is Inuit Nunangat. So this is the Inuit homelands of Canada. So there are 4 regions that span through the north. And Inuit and their ancestors have been part of living in this environment for thousands of years. So deeply connected to the land, deeply reliant on the land, and also identify as people of the sea ice and people who have a direct connection to and a human right for cold climate environment. In recent decades, the north and the circumpolar north, but particularly the north in Canada, has been warming at an alarming rate, which is causing tremendous changes for people. So in Labrador, we are already surpassed the 1.5 degree average temperature change that the rest of the world is very concerned about. And some projections are showing it's already at 2 degrees. And if you look at future projections, by 2050, it's anywhere from 9 to 11 degrees on average temperature change. So if you think about a place that relies on snow and ice for much of the year and that relies on cold weather, and that all species that are here, the lands and the peoples, have evolved within that context, a 9 to 11 degree temperature change is absolutely catastrophic. So when people were talking about what really affected their health and wellness and what were some of the things they drew their strength from, the number one thing that came up for people was land. So being able to go out on the land and connect, to hunt, to trap, to berry pick, to fish, to forage for medicinal plants, to spend time with family, and importantly, to feel that sense of identity that you are doing the same thing that your ancestors have for thousands of years, and that you feel confident and you feel strong in your identity. And so a lot of people talk about this deep connection to land, about it being almost a part of your body. People would say, you know, it's just like another limb. People would call it kin, family. You can see in this quote that there's that deep sense of belonging. It's me, it's us, it's my people. And so there's this very integral, deeply interconnected sense of people and land. And then importantly to that, of mental and emotional health and land. So when people talk about going out on the land and what it means for mental wellness, people talk about a sense of freedom, a sense of joy, of peace, of de-stressing, of connecting to the past, the present, and the future, of being part of something bigger than oneself, of having a strong sense of identity, a sense of place, a sense of connection. And then if that change happens or you're unable to go out on the land as much, then you can see in this quote, people would say they don't feel as much like people. They would feel more stressed, more down, and mental health challenges, whether they're pre-existing or not, suddenly become more complex. And what's really important to note about this region and many other Inuit and Indigenous regions in Canada and elsewhere in the world is there's an extensive traumatic history of colonization, of residential schools, of missionaries, of forced relocation, of children being taken from their homes and their families, and of extensive land dispossession. So there's a lot of intergenerational trauma and a lot of post-traumatic stress disorder, high rates of depression, anxiety, and suicide that stems from this systemic marginalization, dispossession, extreme racism and violence that's in the history. But then simultaneously, there's this incredible strength and resilience that comes from this connection to land, connection to people, connection to kin, and having this access and knowing that you're part of a system and part of a people who for thousands of years have carried on traditions and knowledge about the land and about the waters and about the animals and plants that you share the environment with. So as I mentioned before, Labrador is going through extreme changes. It's been over the past decade in particular, but over the past 30 years, Inuit have been identifying changes in sea ice. So a decline in sea ice in both the extent and the thickness of it, and also the timing. In previous decades, the ice would freeze over by October and stay until June. Now you're seeing the ice freeze up in about January and leaving sometimes end of April, beginning of May. So that's a tremendous shift already. Seeing average temperature changes that are much warmer, so warmer winters and warmer summers. That's leading to increased precipitation. So in the winter, it's more snow, and in the summer, you're seeing a lot more rain. And then in the in-between seasons, it's a lot more stormy weather and fog. So people are unable to get out on land or travel. And it also impacts medical access and food access because these communities are fly-in only. And if the weather is bad or the weather has come down, medical services can't get into the communities, and food shipments can't get in, and people can't get out. The quote on the left that you're seeing on the screen, this comes from a documentary that we made with the 5 Inuit communities of the region called Lament for the Land. And it's right at the end of the film, and one of the Angi-Yukoks, who's the mayor or leader of the community, said, "Inuit are people of the sea ice. And if there's no more sea ice, how can we be people of the sea ice?" And it's such a tremendously deep identity and existential crisis to think about thousands of years of having that identity and suddenly seeing that change and that shift within one's lifetime, and thinking about what that means for yourself, for your family, for your community, and for your culture. So within all of these changes, back in 2009, the community of Rigolettes decided that they wanted to do a holistic study to look at the ways in which climate change was impacting all aspects of health, so physical, mental, emotional, and spiritual. And it was the first time that a sort of systematic research project had been done on health in the community related to climate change. And it was really important that it was led by Inuit themselves. So Inuit were conducting the interviews, guiding the research, elders were providing information and knowledge, and everything was based on oral storytelling, on narrative interviews, and on audiovisual, digital stories, and film. So one of the most fascinating things that came out of this research in the early years, so for 2 years, myself and this team of Inuit researchers and another researcher at the time from the University of Guelph worked together, and we interviewed over 85 people. The youngest person was 9 years old, and the oldest person was over 80. And all different backgrounds, all different gender identities, all different times spent on the land. And no matter the age or the gender or the backgrounds, 100% of people brought up at least one very serious mental health spectrum response. And in many cases, it was many, many people. And this was really some of the early research at the time coming out around the globe where people were actively speaking about this. There was early work in Australia at the time. And so really what people were talking about in the community was things that they had been experiencing but had never spoken aloud and never shared. So the first things that people talked about was the extremely strong emotional reactions. So sadness, distress, stress, anger, frustration, hopelessness, and helplessness. So a whole variety of emotional reactions that they were indicating were impacting their daily lives and causing significant concern when they thought about what they were experiencing and then what they were going to experience. The next area was the stronger psychological outcomes. So where people were talking about depression and anxiety, often who were seeking medical help or getting assistance and counseling for, as well as suicide ideation and suicide attempts. And so what a lot of people were talking about is that, you know, there's been such a strong history of trauma in the communities, and having that access to land has been one of the mitigating factors to support mental and emotional wealth and health, and to keep people, you know, healthy and resilient. And suddenly, with all the changes in climate, with the ice not forming, with things being dangerous on the land and unstable and unpredictable, people weren't able to get out as much. So not only was that causing a direct mental health stressor, but it was also magnifying and amplifying already present mental health challenges. So underlying trauma, underlying depression and anxiety, as well as increasing cases and incidences of new depression and anxiety and distress. People also talked about this reflecting additional trauma that they've had. Some of the older people that we interviewed had experienced residential schools and relocation, and talked about that trauma of being moved from one place that was familiar to another place that was unfamiliar, and that sense of disorientation and homesickness. And then we're indicating that now, even though they're in a place that's familiar, the environment has changed so much, it's no longer familiar, and they feel that sense of homesickness. And this aligns with what Glenn Ulbrich calls solastalgia, so that homesickness while you're still at home. A number of people, particularly the health professionals that we worked with, also raised significant concerns about the increasing suicide ideation and suicide attempts that were being witnessed in the community, particularly around what's called the shoulder seasons. So that's in the fall and the spring, when the ice is either just forming or not breaking or hasn't broken up yet. And it's in these periods where you really can't leave the community because the water isn't open or the ice isn't formed. And traditionally across the north, we see increase in mental health distress and suicide attempts during this time. But now with climate change, it's lengthening from sometimes 2 weeks to 6 weeks on both ends. And so it's increasing stress levels and seeing an increase in suicide ideation or suicide attempts. And also health professionals talked about seeing an increase in drug and alcohol usage during these times, as well as just generally when weather is bad and winter conditions are worsening. So some of the climate change drivers, when we're thinking about Indigenous mental wellness, so not only in the area that I work in Northern Labrador and Nunavut, but also in global Indigenous research that we're seeing emerge all around the world. So as Lisa has already presented, there's these acute pieces that happen. So the wildfires, the flooding, the drought, the sort of immediate pieces that bring out serious mental health concerns, both in the present and then ongoing in the future. But there's also those slower and cumulative impacts, which is very present where I live and work, where people are experiencing the change day by day, week by week, month by month. And there's not one particular break event, but the cumulative mental health stress and pressures continue to degrade overall mental health outcomes. Then there's the anticipatory concerns. This came up very strongly in the research that I do, where people are already experiencing such strong changes, which already have such negative impacts on their health, their wellness, their livelihoods, and their families. And they're thinking about what the science is showing. If Labrador has hit 2.5 degrees average change and we're on track for another 9 to 11 degrees, people think about what that means and how catastrophic that is. And that anticipatory grief and anxiety and sadness and concern has very present day impacts. Then there's the vicarious trauma of thinking about what is happening to others. So there's a very strong solidarity of Indigenous peoples around the world supporting each other in the climate change impacts, and also experiencing the sadness, the trauma, and the mourning together as they're going through the different pains and the changes to their homelands. There's also disruptions to place attachment. And this is, very strongly in many Indigenous places where that sense of place and connection is altering. And then also disruptions to the social determinants of health. So things like food security, access to health sustaining resources are all being affected through climate change. So as I said, the climate sensitive outcomes that we're seeing and that we've seen in this research, but also in global Indigenous populations and indeed in non-Indigenous populations, as more and more research is showing, are what we've talked about: the strong emotional reactions, the psychological outcomes, potential for increased addictions and family stress and violence, increased suicide ideation and suicide, place-based loss, cultural identity and erosion. And what I want to spend a little bit of time talking about is ecological grief and loss. And this is something that really started to come out strongly in the research that I was doing, where people were talking about feeling physically grieving responses and being just completely devastated by the loss of species, by the loss of ecosystems and everything that was coming with that. So back in 2018, myself and Neville Ellis, who's a scholar from Australia who works in climate change and mental health as well, we worked together for a Nature Climate Change article to look at this emerging place of ecological grief and anxiety. And we identified from the global literature, from our own literature, and his work in Australia and mine in Labrador, as well as work from all over the world, kind of 3 parts where people are really strongly identifying ecological grief. So the first, obviously, is that grief associated with the immediate physical ecological loss and those related impacts. Then we're seeing the grief associated with disruptions to environmental knowledge systems and loss of identity. So this is coming up not only in Indigenous contexts, but also among farmers, among fishers, among foresters, people who have specific environmental knowledge and identity connected to the environment that then is being changed by climate change and all the resulting environmental alterations. And then finally, there's that grief associated with the anticipated future losses and vicarious losses. And this is something that we're seeing more and more, particularly in the media, particularly among young people, There's increasing research coming out on this, looking at, and in particular, young people looking at this topic about how much that anticipated loss and the anticipatory and the vicarious piece is really affecting present day mental health and emotional health for people. So, for a lot of people, the narrative is still that climate change is in the future. But for many, many people around the world, not only in Canada, but also in the UK and Low Island states and Australia, everywhere, there's research coming out all over that future is now. And it's really interesting to me to be giving this talk at this moment because this past winter was one of the worst, warmest winters in Labrador, and the mental health impacts that have come up, the increase in clinic visits, the increase in people going to see health professionals and counselors to talk about their grief and their anxiety, and the overwhelming outpouring of people just speaking about this has been enormous. So over the winter, December 2020 to March 2021, so over that month period, we had a 4 to 6 degree above normal temperatures, which is huge for the winter. There were 0 days below -20, and normally there's 20 to 30 days. So again, almost a month difference there. And 13 days on average above 0. And normally there's only 0 to 2 days. And then 82 days with a snow depth of greater than 100 centimeters. So what this means, it was extremely warm. We didn't have cold spells, and there was a lot of snow, and it means it was terrible for ice. So we had very little ice. The ice that did form was very thin. There were a lot of accidents this year, a lot of people going through the ice, a lot of people getting stranded, and high rates of mental health distress because people were stuck in the community, they couldn't go out, they were stressed, they were anxious, and that grieving and that anxiety was very strong. So, when we're thinking about it as health professionals and clinicians, there really is a gift of grief here. A lot of people try to avoid the grief, but we only grieve what we love. And so this idea that, if we're creatures who love, we must be creatures who despair at what we lose. And so I actually think that there's a really powerful moment that's happening here as more and more people are coming together in grief, and that this is a tremendous opportunity for a public health response. Because this grief and this anxiety, they're reasonable and functional responses to climate-related losses. How can we not be sad and anxious when we think about the tremendous losses that have happened, the tremendous loss that's to come, the decrease in biodiversity, the death of species, the changing environments that we live in? And that this population level emotional distress, anxiety, and grief that we're seeing is increasing. And there is an urgent need to respond from the healthcare system, from researchers, from clinicians, from professionals who are working in this area. And you can see in this diagram, this is something that I put together with a number of colleagues who work in all different areas of health and wellness and research that we had in the Lancet Planetary Health that talks about different ways. So, really focusing on a health equity approach. We need more training for mental health professionals on climate change and health, more training for clinicians and doctors. We know there's already proven group and individual and group strategies that we need to harness for climate change. And looking at more social prescribing, so getting out, active transportation, spending more time in the land. And then really understanding that people need this safe, accessible space for exploring the emotional reactions because they are reasonable and functional. And we also need that political will and the ongoing research and the ongoing clinical support. So with that, I'd like to say thank you very much. And I'm really looking forward to the ensuing discussions that we're going to have.
Well, thanks so much, Ashley. It's so shocking to hear what's happening in Labrador, but amazing work that you're doing. And anybody who doesn't think this is a reality out there, an obvious reality, really, that was so powerful. So thank you so much. We're going to move on to our third speaker. We're absolutely delighted to have Elizabeth Wathuti, who is the fourth recipient of the Wangari Maathai Scholarship Award. Elizabeth is a Kenyan environmental and clinical activist and founder of the Green Generation Initiative, which nurtures young people to love nature and being environmentally conscious at a young age. In 2019, she was awarded the Africa Green Person of the Year award by the 11-11-12 Foundation and named as one of the 100 most influential young Africans by the Africa Youth Awards. So amazing that you've been able to join us, Elizabeth. I know it's been quite challenging for you to join us this evening, so I'm so pleased that you made it. So over to you, and thank you for joining us to talk about climate anxiety.
Thank you so much, and hi everyone. I hope my connection is now okay. My name is Elizabeth Wathuti. I'm an environmentalist and a climate activist from Kenya. And for me, I'll be sharing with you more about eco-anxiety. And it would be great to begin with how I ended up being a climate activist and an environmentalist. I grew up in one of the most forested regions in Kenya. And this is a region that is called Nyeri County. And it's a region that is famous for its beautiful forests and also home to my greatest source of inspiration, the late Professor Ngare Maathai, who at that point in time was my member of parliament. And she was also the first woman to win the Nobel Peace Prize in East and also in Africa in general. And she has greatly inspired my activism here in Africa. And so for me as a child, I got an opportunity to plant my first tree when I was only 7 years old. And this was in one of the most beautiful hills and forests back at home that I could spot every time when I was in my classroom back in primary school. And I remember this moment was so memorable. And at some point in time, I decided to go back to this hill and forest just to try and spot and see if I can trace back the tree that I planted, because I do believe in growing trees up to maturity. And I remember when I got to this place, it was a moment of anger and heartbreak and sadness, because what I found was a whole line of tree logs and tree stumps, which showed that all the trees had been cut down. And possibly, and maybe, I thought to myself, then maybe the tree that I planted when I was 7 was also among the trees that had been cut down. And so this was so heartbreaking for me to just see how people did not appreciate the value of that forest. And I remember how good everything was when I was studying in school close to that particular hill and forest. And so this really broke my heart, but this anger gave me a hunger to want to do something about the challenges that I was facing at that point in time, and also challenges like deforestation, pollution, and challenges like the climate crisis. And as you know, right now, the climate crisis is no longer a future concern for us here in Africa. It is happening every day. People are experiencing the impacts every other day. And it is no longer something that is going to be in the future. We are already losing so many people, and also we are having so many people who have their livelihoods and their lives, and the very places they used to call home, they're losing them all due to the impacts of the climate crisis. We have had instances where floods, droughts, desert locust invasions, acute water shortages have affected so many people across the African continent. And all of these things continue to affect and really impact greatly on most of us here in the African continent. At the end of the day, these people have to go through lots of these eco-anxiety, because it's about how bad the situation is going to be in the next coming years. And it's also about the loss and damage that they experience every day. Anytime there are floods or these desert locust invasions or any impact of the climate crisis, there are people that are counting losses and damages each and every day. And at the same time, they are worried about how the future is going to be if we continue with no action at the end of the day. And so for me, eco-anxiety and also how young people have to deal with it is mostly about how we turn our reactions into action. I've had so many instances where I have engaged with young children and young people, especially through the Green Generation Initiative, because when I got this anger from the landscapes that I used to call home, the landscapes that really made me connect to nature and love nature at a young age, then I had every reason to step up and fight for these spaces. I had every reason to step up and fight for my landscapes and make sure that they are well protected. And I remember at some point, I took children to one of the most polluted streams in Nairobi. And the reason why I was doing this is because I believed in having that connection with nature, and I believed in giving every young person a first-hand experience to the natural surroundings. And so what happened, I took these young children to one of the nearest streams in Nairobi, and they asked me two questions. And one of the questions they asked me is, who did this and what can we do about these challenges? And I remember really seeing the sadness in their faces. And I remember them explaining and also sharing their vulnerabilities in terms of how their environment and the surrounding environment could continue to affect and impact their future. And for me, this is an opportunity to continue engaging the young children and engaging young people in making sure that they shape the kind of future that they want to see every other day. And so I started to begin campaigns in different schools. And this, one of the most campaigns that I started was a campaign that I dubbed Adopt a Tree campaign, to make sure that every child in every school in my country would get an opportunity to plant and adopt a tree each in their school compound. And this was also in a way to make sure that I am being a part of the solution to the challenges that are being faced in my own landscape, the challenges like deforestation. Because apart from the one forest that was being degraded, the forest that I planted my first tree when I was 7, there were so many other landscapes that continued to be destroyed every other day. There were so many tree logs. Every time I went to the city, I could see the streams flowing with plastic waste. And at some point, I remember I would see it as a soup of poison, because at the end of the day, these streams need to be clean. They're the same streams that we depend on to get the water that we drink every other day. And so this campaign that I started was to make sure that the children get to change their mindsets and not only get worried about the future, but also make them begin to understand that they can be a part of the solution in addressing the global environmental challenges that we are facing every other day. And so far through this campaign, we've been able to plant over 30,000 tree seedlings, and not just to plant, but we've been able to grow these seedlings, because we're making sure that these seedlings get to grow up to maturity. What happens is that every child gets to plant, water, and nurture that tree until they are done with their life in school. And the other thing we also focus on every time is to make sure that they are practically educated on the surroundings and also educated on the challenges that we are facing. And we also identified the challenge of food insecurity that continue to greatly affect the African continent. And this is the challenge that also greatly affect and impact the children and women. And so what we decided to do was to make sure that we also reduce this pressure, because most of the children that we were educating would go a day without a meal. And so we thought to ourselves, how can we make sure that this tree growing campaign continue to also impact the food security? So we started to establish food forests in designated corners of the school compound. And we would pick species that would grow and do well in the different schools that we were targeting. And this would mean that these fruit trees would continue to benefit the children, because they would supplement the school's feeding programs. And these fruit trees also in a great way acted as a food supplement and also a nutritious source of food for them. And so we felt that through this, we were increasing the country's forest cover, and also at the same time, making sure that the children had a nutritious source of food for them at the end of the day. And then we also wanted to make sure that the children have got a connection to nature, because most of the schools that we were going to had the challenge of not having a space where the children could directly connect to nature. And so what we did was, how can we make sure that these children would get a space where they can directly link and connect themselves to nature? So we started the Green Schools model, where now we would incorporate all the aspects into one green structure. And these aspects include the forestry, the wildlife, climate change, waste management, water and sanitation, and just to make sure that all of these aspects would be in an eco projects demonstration corner in the school compound. So we've been able to do one of these eco projects demonstration corners in one of the schools in Kiambu in Kenya. And this project is already impacting so many communities and the surroundings. And what it contains in there is a kitchen garden for food security. And there's the food forest. There's a green fence as well. And also we are having the tree nursery and a park where the children can be able to continue with their day-to-day learning activities. But at the same time, they would continue to learn about nature through this structure. So for me, I do believe that eco-anxiety really exists, and it's all about making sure that we understand that it is okay to grieve when our ecosystems and surroundings are degraded, because this is what really gives us that natural call to action. And it's also about making sure that we educate the young people and the children at different schools about how to deal with their anxiety, because a lot of young people are really worried about how the future is going to look like. We have been speaking up and sounding the voices of urgency every other day, but still we do not see much action from the world leaders. We are doing the best that we can from our own capacity. We are starting up initiatives and trying to show everybody what it means to take urgent action on the climate crisis. But still, we don't see the bold climate action steps that we need to see in order to believe and also see that we have a livable world and a safe future. So what this means is that eco-anxiety really exists among young people. I have had so many instances where young children and young people in general have shared with me their vulnerabilities about the climate crisis, and also their vulnerabilities about how they see humanity treating nature. So I think the best thing that we can all give to the next generations right now as the entire human race is to end the war against nature, because all of these things that we continue to do every day that are harming our planet continue to escalate eco-anxiety among young people. And it's also a responsibility to make sure that young people also understand how to deal with eco-anxiety. I have shared with you my story today that my anger gave me a hunger to want to do something about the challenges that I was experiencing, about the heartbreak and the pain that I felt when I found all of those tree logs down and when I witnessed deforestation. And this is something that I feel every other day. And I think the most recent experience for me as a young person was a campaign that we recently did on Valentine's Day, because I am also a green spaces champion, where I advocate for the protection of urban green spaces, which we really need right now to make sure that our health and well-being is okay. And unfortunately, in our city, we have this notion where development seems to be coming ahead of the green spaces and ahead of nature. And so we're on this campaign on Valentine's Day, which is a month where everyone is showing love to their loved ones. And we decided we are going to show love to the trees. So we marched to the city of Nairobi and hung love hearts to every tree that had been marked for felling by the government to construct one of the biggest highways called the Nairobi Expressway. And for us, it was a moment of joy. It was a moment of sharing how we feel about nature. It was a moment of also sending a message to the world that they are not just trees. They give us oxygen every day. They're the reason why we survive. They're the reason why they continue to help us have our well-being and health at check, even in the city where there's pollution, in a city where there's so many cars that are emitting every other day. And so we took this act of courage as young people to demonstrate that we need to strike a balance between green spaces and the trees. But unfortunately, 2 weeks after we did that activity, we found again so many tree stumps that they had cut down those trees and they were going to go ahead with the construction of that road. It was also another heartbreaking moment for us as young people. And for anyone, normally you would give up and possibly say that our efforts are not being appreciated, or you would possibly think that maybe then we're not speaking up too much, or maybe no one wants to listen to us. But for me, I took this as an opportunity to continue raising my voice further in terms of how we need to strike a balance between our green spaces and development. And every time I reflect on these challenges, every time I reflect on the heartbreaking moments that I have witnessed nature being destroyed, it powers me as a young person to continue stepping up and speaking up for nature. Because at the end of the day, we young people will have to live longer with the consequences of the world's inaction today. And we are also the ones who are going to experience the worst impacts of the world's inaction today. And it's sadly that we are also the ones who are taking the bold actions and steps from our communities, our initiatives. And we want to have our voices heard around, and we want to not just have our voices heard, but also understand and see to it that our leaders are actually taking note of what we are doing and they're acting upon it. So my call to action for you all today is that the reason why young people were experiencing eco-anxiety right now is because we are greatly disturbed about how humanity is treating nature. And we feel that it is time for humanity to start treating nature right. Because if we don't start treating nature right, then we are the people that will have to live longer with these consequences. And we do not want to live in a world that is not livable. We do not want to live in a future that is not even safe and assured at the end of the day. So it is everyone's responsibility right now, from every position that you hold, whether governments, corporations, individuals, everyone can participate to make sure that we shape this future, to give us young people the kind of future that we want to see at the end of the day, to give that 3-year-old, 4-year-old, your grandchildren and children, the kind of future that we all want to see every day. Because eco-anxiety is happening every other day. Young people are worried, they're frustrated, a whole mixture of feelings about how the future is going to look like. And of course, we cannot shy away from the fact that eco-anxiety exists. And the best way to deal with this is for us to begin seeing bold actions happening, not in 2030 or 2050, but we need to see these actions happening right now. Because for instance, we are seeing so many countries right now committing to net zero when it comes to the climate crisis. These commitments are around the year 2050 or 2030. And while these commitments send a really important signal, it is great for us to note that what really matters right now is the decisions that we are choosing to make right now. And also where we choose to invest our human and financial capital right now, because that is what is going to matter in the end. Because the climate crisis is not on hold right now, it's still affecting so many people. And in fact, so many people around the world right now are disconnected, and they have to deal with both the COVID-19 pandemic and also they have to deal with the climate crisis at the same time. And while we may seem as if we are in the same storm, which we are definitely not in the same boat. And this is one thing that we should be reflecting on every other day, that yes, we are in the same storm, the COVID-19 pandemic, the climate crisis, but we are all in different boats. And when we recognize this, then we will have addressed the different challenges that we are facing today, including the challenges of how different people experience eco-anxiety differently. Because like I have mentioned in the African continent, climate change impacts are not a future concern. They are happening every day. And so every person right now whose house has been washed away by the frequent storms of floods right now, they have to deal with the loss and damage of their families or loss and damage of the very place they called home. And at the same time, it's about how the future is going to look like. A lot of people talk about how women will be greatly affected by the climate crisis, for example, and they talk about how women have to walk for long distances in search of water or food for their families. But really, the real climate stories is the fact that these stories are actually happening every other day. And I think this is one of the experiences that I have had in the past 2 weeks, where I visited Samburu County in my country. And I remember crossing a bridge of what was supposed to be a stream or just a river, and it was dry by that time. And then I spotted a woman with her 3 children trying to look for water. And when I got close to them, I discovered that this woman was hand digging a hole and a well to get water for her children who were crying by her side. And really what struck me was the fact that this water that she was digging was actually not safe for consumption, which means that it also continues to risk her health and the health of her children. But she had walked for 12 miles to get to that place in order to be able to feed her family and her young children, who are there, the people that are going to really inherit this planet. And so all of these things are the climate stories that we should be telling out to the world in order to understand that it is no longer something that is coming in the future. It's affecting so many people. And just because it's not happening where you are, it doesn't mean that it's happening. It doesn't mean that it's not happening at all. There are people that have to face the worst impacts of this crisis. And so what we need to do right now is to take urgent, bold climate action, because we do not have any much time left. And it's all about making sure that we support the people that are greatly affected. And the sad bit is that the people who are the most affected are the ones who have the least capacity to adapt, and also the least number of resources to be able to adapt to this crisis. So we cannot do away with nature. We need nature for our survival. We need nature for our health and our well-being. And nature is also the ultimate climate solution. So what we need to do right now is to recognize the role that nature plays. And in addition to stopping the investments in fossil fuels, we have to regenerate nature quickly and also make sure that our remaining ecosystems continue to stay intact. And at the end of the day, we have to also end the war against nature. And allow me to end with one of my favorite quotes from the late Professor Ngare Maathai that says that those of us who understand, who feel strongly, must not tire, and we must not give up. The burden is on us who know. Those who don't know are at peace. We are the ones who know that get disturbed and are caused to take action. So thank you so much for this opportunity.
Well, Elizabeth, that was so powerful. And as you were speaking, some of the questions that have been asked, you were answering them as we were going along. We are going to extend this session by another 5 minutes. And I think we've probably got time for at least one question. And one of the challenges that you threw out, Elizabeth, was the world leaders not taking enough notice, and clearly they haven't. And we've got COP26 coming to the UK at the end of the year. If you have just 1 minute in front of the world leaders, what are you going to say to them, and what are you going to ask them to do now? So just one minute each. Elizabeth first.
Thank you. I will have 3 asks to the world leaders. And one of them is to immediately stop all investments in fossil fuels and begin to invest in nature regeneration quickly, and also make sure that all our remaining natural ecosystems stay intact. Because at the end of the day, it is about how we are treating nature. We have come into this mess because of how we have wrongly treated nature. So this is the time for nature, and the time for action is right now.
Okay, thanks for that. Ashley.
Yeah, I think in addition to what Elizabeth said, I would actually put Elizabeth in front of the COP leaders and say, just do that presentation for them. But to build off what she said, and what we've been talking about today, is also to build policies as though people's mental and emotional health matter. So trauma-informed policies that understand that there is an intangible loss and damage that's happening, as well as the direct infrastructure. We're so focused on the economic costs of climate change right now at the large policy discussions that the health is often overshadowed, especially mental health. Understanding that eco-anxiety, the grief, the loss, the sadness, all of the pieces that come there, and creating policies that support, that are health sustaining, but then also, you know, as Elizabeth was mentioning, you know, supporting ecosystems, like immediately stop the investments into the fossil fuels to support that, so that what is causing the distress and anxiety and loss and grief is actually diminished at its core.
Thanks, Ashley. Lisa.
Yeah, what to add to that? I think primarily I want to see action on this from government leaders, and I think the time for waiting and pausing and seeing who's going to go first is gone. People, you know, countries need to commit and show how they're committing. I would like health more centrally in the conversations. So this isn't primarily for me an economic or even an environmental issue. This is a health issue. So I'd like to see that foregrounded more in conversations about climate change. And I'd like to see the ecological degradation also foregrounded that climate change is one part of this, but actually it's a bigger picture of environmental destruction that needs to be addressed and completely prioritised in our societies.
Just one final question, just briefly. People will be watching, they'll have been moved and will want to do something. If you could say to everybody that's joined us this evening, what's the one thing, I know there's so much we need to do, but the one thing that you can do tomorrow to assist, what would it be? Lisa first.
I'd say talk about this to friends, family, work colleagues, and think about that list I showed of where you feel comfortable acting, and if possible, do so in your workplace.
Great, thanks. Ashley.
Yeah, absolutely. Talk about this, normalize it. Grief and anxiety and all the mental and emotional effects are a completely reasonable response. In fact, I think it's unhealthy if we don't feel these responses to the degradation of the whole global ecosystem, but also leverage the areas that you have. So find the spots that you can make the biggest difference and act there. You know, everyone's got a different role to play and there's no one pathway to change, but finding that area that you can contribute to most and just pushing as much as you can and pushing the leadership and the political decisions to make that change, because it is immediate. It's not a future change anymore. It is now.
Great, thanks. And Elizabeth, I think it's right that you get the last word.
Thank you. There's so many challenges that are surrounding each and every one of us from our countries, our communities, and globally. And I think the best thing that everyone can do right now is to identify with the challenge that surrounds you and then choose to take action to make sure that that challenge is addressed. And you don't have to do very huge steps. You just have to use your voice and use every action that is possible from your capacity to make sure that you're doing something to address that challenge. Because many are the times that we are reacting to challenges and we are not being proactive. So my word today would be, let us see how we can turn our reactions today into action to do something right now that is going to impact the next generations positively. And it's all about making sure that we are not really being spectators, but we are making sure that we are doing everything that we can. We may not be part of governments that can make the huge decisions, but we have voices that can speak to our leaders to make sure that they are stepping up and also doing what they're supposed to do in terms of addressing the climate crisis. And lastly, we need to remember that it is those small acts that we do every day, multiplied by millions of us, that are going to change and impact this world greatly.
Great. Well, thanks so much for those reflections. And this is about action. So just to finish off, please do remember to complete the survey, as we appreciate the feedback, and CPD points will be issued to those who have completed this. If you're watching a recording of the webinar, please remember that CPD points will only be issued to those watching on demand through Zoom and not through YouTube. A full resources page and recording link of the webinar will be sent in the follow-up email. The next episode, really importantly, on the 22nd of June at 6 p.m, will be focusing on building a greener healthcare system, where Dr. Nick Watts, the Chief Sustainability Officer of the NHS, will be chairing a panel discussion. I really want to thank our speakers, three amazing speakers from across the globe, Ashley, Lisa and Elizabeth. Thank you so much. I found it a very informative, educational and moving. And a special thank you to Michael Rapp for his generous support enabling free access to this webinar. So thank you, the audience. Thanks for your questions. Thank you to the team at the RSM, particularly Rosie and Sean. And what I'm going to take away from this, turn reaction into action, and that this really is a moment, and we should respect grief, because we only grieve what we love. So thank you for joining us, and enjoy the rest of your evening.